Has anyone here been sick recently?
No.
Okay.
We've been pretty much locked down for like 20 days now. We haven't really left.
Okay.
Carrie here from HomesteadHow. It's day 21 of being locked down on our homestead. April 1st was day 21 of us being on lockdown. The purpose of this video is to update our family and friends about Lily's situation and what happened yesterday. So this isn't going to be the typical video. There's a lot of people that are concerned about Lily, and instead of calling 65 different people and telling them the story over and over again, I'm going to do that quickly in today's video. Yesterday at about 2 o'clock, Lily was in the bathroom and she screamed for her mother that she was dizzy and she was passing out. Jen ran in there and grabbed her, and then Jen started screaming at the top of her lungs, and then I ran in there and Lily completely collapsed onto the floor. It was horrifying. Her lips were purple, her face was white, her pupils were like as big as her whole eyeball, brown part of her eyeball should be, and she was breathing like and you could just tell she wasn't getting any oxygen, and her eyes were open but she wasn't there. She was completely out of it. And I was holding her head up, and Janelle ran, grabbed the phone and called 911. And this is all just extremely terrifying with everything that's going around right now with the coronavirus. In fact, shortly before this happened, I think yesterday, I've been watching way too much YouTube, but I was watching an ER doctor that he brought a camera in and he was showing the patients, and he just said one patient just came in and their face was white and their lips were turning purple, and they were giving them CPR because they couldn't breathe. They had the coronavirus and they passed away. Those are the exact same symptoms Lily had, so that's all that was going through my head. Although in my brain I'm like, I don't know how she could possibly have this virus, because we've been so careful. We took them out of school a week before everyone else did. We've been completely locked down for 21 days. They haven't gone in a grocery store, a bank, anywhere. We left the house 2 or 3 times. They stayed in the car. They haven't interacted with any other people, so I don't know any way she could possibly get it unless it came through on some of the groceries. An ambulance came and picked her up, and they took her blood pressure, and her blood pressure was like 110/45. Her heartbeat was 145 beats per minute. I took her temperature while we were waiting for the ambulance to come with 2 different thermometers, and it was 95 degrees on one, 94 degrees on another. It was really a bad situation. The ambulance came and she started to stabilize a little bit. They got her in the ambulance and they took her to Portage Hospital Divine Savior, which is about a half an hour from our house. And then it was hours and hours and hours before we heard anything. The whole time in my head I was just terrified that the hospital was going to be over capacity and that they weren't going to be able to give her the proper care that she needs. But thankfully that wasn't the case. They did a bunch of tests on her, and including COVID-19 coronavirus test, which takes 3 days to get the results on. But they did a CT scan of her chest, and they found that she has 2 large blood clots in her lungs, and that's what's causing her trouble breathing. And they haven't ruled out the coronavirus yet, so that's a pretty big deal. So the Portage Hospital called the Flight for Life helicopter, and she took a helicopter from the Portage Hospital to the Madison Hospital. This all happened yesterday. I got in the car from here because Jen took the ambulance with her, picked up Jen, and then we both drove as fast as we could to the Madison Hospital, and we got her at about the same time as we saw the helicopter landing with her. So she was overnight in the hospital. I just got home today, and she's okay. She's doing stable now. They have her on a bunch of oxygen. They're giving her a bunch of medicine to try to stop the growth of the blood clots, and some additional medicine to try to break up the blood clots. They did another COVID-19 coronavirus test on her this morning, and because they can get one done in 8 hours where the Portage Hospital took 3 days, so by this afternoon or by the time I do a video tomorrow, we should know whether or not she has coronavirus. I'm hopeful and optimistic that she doesn't have that, because the symptoms, although the symptoms all could be coronavirus, the shortness of breath and the blue lips and the low blood pressure, those are also symptoms of the blood clot, which they did find. So the odds of her having a blood clot and coronavirus should be pretty small, I would hope. But because they took those tests, they're treating her as though she has the coronavirus. So I guess I'm trying to update everybody, family, friends that are concerned about her. This is an easier way for me to do it versus calling 50 or 60 different people. She's doing well right now. They have her on oxygen. She's at Children's Hospital in Madison, and her numbers are looking better while she's on the oxygen, although when she moves around or gets up and down, those numbers are tending to drop. It looks like she's doing okay so far. They're waiting for the coronavirus test to come back this afternoon, and then they want to give her an MRI. If she has the coronavirus, they can't just put her in an MRI machine. There's like a 4-hour procedure they have to do if she has it. So they're waiting for that before doing that test, and then they're going to do some other tests to see if the medicine they gave her is breaking up the blood clots that she has in her lungs. So that's kind of where we're at right now. A couple things that we learned from this, I'm just trying to be positive. I feel so horrible for my daughter Lily. She's been through so much with her open heart surgery 2 years ago. She had trouble healing with her scars from that surgery, and about 2 months ago she had another big surgery on her chest, and we just keep telling her, this is it, Lily, you just do this and you're going to be done with these surgeries. And now she has this happen to her, and the poor thing is just completely terrified with all of the news and the coronavirus. She didn't want to go to the hospital just for fear of getting the virus from going to the hospital from all the stuff she's seeing on the news. Thankfully, I guess, looking at the positive side of things, when we were in the Portage Hospital, I asked the doctor who's flying with her in the helicopter to Madison, what's the capacity like at the Madison Hospital, because I was worried that she's not going to be able to get the care she needed because they're going to just be overloaded with virus cases, coronavirus cases. Thankfully, that was not the case. Because she's a child, she's going to the Children's Hospital. Coronavirus doesn't affect children as much, so the capacity of the Children's Hospital was actually really good, coupled with the fact that all these stay-at-home orders are preventing people from doing stupid things like getting in car accidents or drunk driving or whatever else. Or people are calmer and staying at home, therefore those normal cases you have in the hospital are a lot less. So he actually said this is a really good time. Like if you're in New York right now, a lot of those hospitals are over capacity, but we haven't hit over capacity, thankfully, in Wisconsin yet. So this was actually a really good time. We got into the hospital and there was almost nobody there. But because she's has coronavirus symptoms and they're testing her for it, they have to treat her like she has it. So it's just crazy. She's in a containment room. There's 2 doors on the hospital room, and when we went in there was 6 or 7 doctors and nurses. There's the cardiologist, the respiratory therapist, her doctor, the nurses, and they come in, they wash their hands, they put on all their personal protective equipment. They have plastic face shield, they have the N95 mask, they have scrubs that go all the way down. It's almost like a robe that they're wearing. They have gloves they put on. They come into the room, they talk, they examine her, they do their stuff, they leave the room, they take all of that stuff off, throw it in the garbage, wash their hand, and then go through the second set of doors. It's just, God bless these nurses and doctors. It's absolutely amazing the things they're doing. Her nurse is coming in to care for her in the hospital. They're coming in and checking the blood pressure and checking her oxygen levels all throughout the night. I slept there last night with Jen at the hospital all throughout their night. Every time she's got to come in, she's got to put all that gear back on, brand new gear. She leaves, she's got to throw all that gear in the garbage, wash up again. I mean, it's just a huge process just to get in and out, just because they're being extra safe about this virus. So I guess this is not the normal video. I just wanted to update everybody that's concerned about Lily. We appreciate all of your prayers for Lily, and we will keep you posted. I'll do another video tomorrow. Obviously, my number one priority is caring for Lily. I just got back from the hospital because my dad was nice enough to come over and take care of the triplets last night, and so I came back today, and I'm going to grab some stuff for Lily and Jen, and I'm going to head back over there. But looking forward to getting the coronavirus test results back today, which are going to be negative, I hope, and then hopefully getting some good news about the blood clots. Hopefully the medicine that they've been giving her has dissolved those. If it didn't, then the next step is possibly doing a surgery, which may be something that they put through her wrist or through her leg to try to get in there and surgically remove or aspirate those clots that she has in her lungs that have been preventing her from breathing properly. Part of the problem with this is Lily's really, really tough. I keep telling her this is horrible that you had to go through all these surgeries, but I keep telling her you've been through open heart surgery so you can do anything, and she really is a really, really strong person. It's been absolutely amazing because I mean, we feel horrible. She's been struggling to breathe for a while now. We've called her doctor and we've talked to them, and it's not uncommon for someone with open heart surgery to have trouble breathing afterwards. When you have open heart surgery, they break all your ribs, they sew them back together, and if you're taking big, deep breaths, it hurts like hell after open heart surgery. So what tends to happen is people take shallow breaths, and then they get used to it, and then subconsciously they end up breathing like that for a long time. They actually need to go to physical therapy to learn how to breathe deeper and regularly again. So for part of that reason, this has sort of been masked, because for the last 2 years she has had trouble breathing. She's gone to physical therapy, she's been working on it. The doctors say, hey, she just needs to get out there and exercise more, condition herself more so she catches her breath. That's been the case up to this point, and so we've been kind of pushing her. You got to exercise more. As you've seen in our videos, we've been going for a walk every single day. We did one 2 days ago, and she was really struggling after a while. And then we talked to the doctors, and they say, well, she just has to condition herself. It could also be anxiety with everything she's seeing in the news, but it turns out no, this whole time it's because she had a blood clot in her lungs, and she's been struggling to breathe because of it. And she's so tough. I mean, she mentions it and she says, look, I'm having trouble breathing, I need to work on it. She's still going for walks, she's still pushing through it. I think anybody else would have been at their knees. I mean, it's like breathing through a straw, the capacity that she has with her lungs right now. And looking at her O2 levels, they were dangerously low. So much so that her lips were purple and she passed out and nearly died in her house yesterday. So I'm trying to be positive for Lily. I always try to tell her, this is so unfair. I wish I could take your place. I would give my life if I could take the place of her and not have to have her suffer anymore. On the flip side, I think everything always balances out in the long run. I said, you're going through all this suffering now, but you're going to have a long, healthy life, and you're going to be stronger because of it, and it's going to shape your character differently because of it. And I believe that is true. It's hard to kind of wrap my brain around right now. It's just so many things happening over and over again. But number one priority now is making sure she's safe, and I am a lot more confident after visiting the hospital and seeing all the precautions they're taking, the fact that there's hardly anybody there. My biggest concern now is once we get through this, that she doesn't get the coronavirus, because her lungs are compromised with these blood clots that she has. If she gets the coronavirus after this, it could be quite serious with that underlying condition. So we're just going to take it one day at a time, and we'll do another video tomorrow. I guess to end this on a good note, Lily was in good spirits when I left the hospital an hour ago to come home. As you know, on our channel we joke around a lot and we try to find humor in things. So I said to her, I said, Lily, you know what, this has to be, I said, I got to give you credit, Lily. This has to be the most elaborate, well thought out, well executed April Fool's Day joke I've ever seen. I said, I don't know how you pulled it off, especially with that helicopter ride you took. She thought that was pretty funny. In fact, she was texting with one of her friends, and I think she texted them a picture of herself in the hospital bed that said April Fool's Day, so she got a little bit of a laugh out of it. She's kind of tired, but she's in good spirits, and she's just worried that they're going to have to do some sort of invasive surgery. So we're praying that the medicine they're giving her will be able to break up the blood clots, and she's not going to have to go under the knife and have surgery again. So that's it for this video. I just wanted to post this out there for all of our family and friends, all of Lily's friends and Girl Scouts that are concerned. We've called a couple people. I apologize if I wasn't able to call everybody. Been running back and forth between the hospital, and I'm home now. And I just figured I'd put this video out there and update several people at one time versus calling 50 different people and saying the same story over and over again. She's doing well right now. We will update you again in tomorrow's video. Thank you.